Hiya, I'm Teoh, obstetrician, gynecologist, and fertility specialist in Perth. Today I'm going to show you a couple of egg collection needles that we use in IVF. I'm not sure in the public how often you get to see this. And I'm going to talk about different techniques of collecting eggs as well. It is actually one of the most commonly debated topic among IVF specialists, the clinicians. Right, without further ado, let me show you one of the egg collection needle. This is a single lumen. I'm going to open it and show you different parts of this egg collection needle. It actually looks quite long. There's a sheath on it. Quite sharp near the tip. I'm not sure whether you can appreciate it. Hang on. It's not going to focus on the camera, but you know, it's quite sharp at near the tip. I'm not going to touch it in case I cut myself. It's quite long, but actually the part that we use, as you know, for egg collection, there'll be a scanner. Trying to show you this is ultrasound scan. We have the same ultrasound scan as normally used, and that's extra guide for us to use the needle to collect the eggs. And usually the part that we use is only a couple of centimeters. We use the most 3 centimeters or so. The rest is more like a guide, as you can see the handle for us to hold on to it, rather than because it looks horrible. Just as a scanner can looks horrible, but actually it's a tip. The rest is a handle, same as a needle. It's only the tip that's being used. And this is a single lumen, so it goes to the ovary, and that's this part where you connect it to the test tube in a part called test tube baby, because in this part connected to the test tube, so the eggs will, we collect the eggs will go through the tubing and then eventually come to the tube. And this part is, you use a pump to create the vacuum to suck the egg in, and then you come here. So eventually what you will have is like I just put water inside, like a tube inside, and with the fluid from the follicles, from the ovaries. So you pass it to the embryologist, and embryologist will look under the microscope to see whether we can find any eggs. This is a single lumen. That means only one channel, one that for the eggs to come in. Now I'm going to open a different one. This is a double lumen. So this one is slightly thicker because inside the needle there are 2 channels, one to suck the eggs and the other one's for flushing. I'll let you know what is flushing in a minute. So like before, I'm going to connect the tube in. This is again suction the eggs. This part you connect the pump, and you suck the eggs into the test tube and the fluid. Now, as you can see, there's a second, getting a bit long. As you can see, there's a second channel here. What you do is you put your syringe in, and inside the media, the fluid that embryos or eggs like. And what you do is when you push this syringe, you might not see it from the camera there, but actually, let me try. Yeah, you can see fluid dripping out. So essentially, just wipe the water from my computer. Don't want my computer to get wet. So essentially, it's 2 channels, one in and one out. Why do you do that? Why do you flush and why do you not? This is one of the topics, as mentioned, being debated a lot by fertility specialists. If you think this is in the follicles, right? In the follicles with eggs, once you suck, the fluid will be gone, the follicles will shrink. So the worry is the eggs, even though you suck in all the fluid, the egg might be left behind, so you may not have got the eggs yet. So when you push this in, you push the syringe, and then the follicles will fill up again with fluid, and then you suck again, you push again, fill up again, then you suck. Basically give it a second chance, third chance to refill that follicles with fluid and suck again, fill up, suck again. So the idea is just in case the first round you haven't sucked in enough eggs, or that egg inside the follicle, then you flush it. Hopefully, it's called the flushing technique with a double lumen with a thicker needle. Now, they are strong, just like anything else, they are strong advocates for single lumen. Some people never flush. There are also advocates for double lumen. Some people always flushing. So I'll let you know the pros and cons for each one, and then I'll let you know what I do. The pros for, let's start with double. The pros for double is basically, just in case you haven't got an egg yet in that follicle, you flush it 2 times, 3 times, then you might get it the second go, third go. So you make sure you get an egg. Sounds good. We do what we can to get all the eggs, as many eggs as we can. The downside, firstly, the needle is a bit thicker. If by looking at the needle you don't appreciate, actually slightly thicker. So during the procedure there could be a bit more blood loss because the puncture hole in the vagina is a bit bigger. So there's more chance sometimes the bleeding doesn't stop. You may have to put pressure to stop the bleeding, or perhaps you need to put stitches. I've done a few times to close the bleeding point. To stop the bleeding essentially. Secondly, there's this question on whether flushing creates an extra stress for the egg in the follicle. The fluid that we use here, although we try to warm it up, but it cools down very quickly. So essentially the eggs and embryos, they all like warmth. So the question is whether flushing in here using cold water, does it cause stress to the eggs when you try to collect them? And also when you push the follicles from, keep opening up and close, opening up, close, there are turbulence inside the follicle itself, whether it can cause mechanical stress to the eggs itself as well. Flushing is also known to take more time. So when you do egg collections, if you don't flush, you just go from one and then move on to another one to another one. It is faster, but flushing takes much longer for the flushing process to happen. It does not matter if fertility specialists have to spend 10-15 minutes extra per patient, which is totally all right. However, efficiency has been proven to improve success rate. What it means that if you got eggs, you pass on to the embryologist. Imagine some patients have more than 10 eggs or even much higher number. So really you want to pass it to them as fast as you can. They will look into it, do what they need to do, fertilize them in good time, keep them warm. So efficiency is important here. So whether too much flushing will delay the process, that is this question. Go to single lumen. As we know, it's thinner, so the amount of blood loss is less, and the chance that you have heavy bleeding where you need to put a stitch on or put much pressure on is much less with a single lumen non-flushing needle. Without flushing, there's no mechanical stress, there's no temperature stress on the eggs. Well, a bit less. And also, as mentioned, it's a bit more efficient in good time. What do I do personally for patients if I know we've got a good number of eggs? Then I usually use non-flushing technique because I believe, as I mentioned, that efficiency is important, and get the eggs in good time, keep them warm, and do what we need to do in good time with the embryologists. For patients with lower follicle counts, as an example, maybe less than 4, definitely less than 3, or less than 5 sometimes, depending how big they are, then I might think, look, the egg count is going to be lower, and and it is important that we get all the eggs that we can. Then I move on to flushing techniques. As mentioned, it is still a topic being debated amongst fertility specialists, and it's not unusual for some people. They never change, they only use flushing. Some specialists will never change, they only use non-flushing. But I've mentioned to you what I do. That's about it this time. Bye bye.